Kelsey, thank you very much. Well, we are talking about surgeries when it comes to our dogs, and this time of year, apparently dogs are just like humans. You get out more and you start playing around, things can happen. Dr. Jerome Williams is here from Red Mountain Animal Clinic, and Dr. Paul Vaughn. He is a veterinary surgeon of Birmingham, Surgery of Birmingham. Good morning, both.
Good morning. Good to be here.
Good to see both of you. So I said on the outset, just like humans, the weather starts getting a little bit better, people start getting outside, accidents happen, same thing with dogs.
Absolutely. I mean, so these dogs are out, they're enjoying the weather, people are letting them get more exercise, which is great. We see so many patients that don't get enough exercise and get fat, but these are dogs that are out getting exercise and they get hurt, and that's what, when we oftentimes end up seeing them.
And there are typical problems, right?
Yes. Car injury is probably the more common that you see. Overextending themselves by running harder and more, vigorously than normal. But I believe you've got some evidence of some of those injuries that you're seeing with you.
So these are some of the surgeries that you've done or that you are doing. So let's take a look at some of these. What are we looking at here, Dr. Vaughn?
Yeah, so this is a broken radius and ulna, or the forearm of a dog. And this dog actually was riding in the back of the truck, unrestrained, and he jumped out, and it didn't go well for him, and so he broke his...
So how he landed on his...
Yeah, I mean, the truck was moving at speed, and
he jumped out as it was moving.
Yeah, this was a moving
goodness.
vehicle, so broken pelvis, broken arm. This is how we put it back together. You can see there's a plate and a pin in there holding everything together.
That's a lot to do to a dog.
He's a bionic dog now. He's got a lot of metal in there,
That's funny.
But it's,
recovering well?
He did great. He full recovery.
Okay, let's go to the next one.
Next one, this guy was out wandering around, and he got shot, and he's actually been shot a couple of times.
Those are great-looking dots we are seeing. Those are buckshots, I assume.
Yeah, so he's got buckshot, he's got some birdshot in there,
and
he's got a broken tibia or calf bone, and so he is even more bionic than the other one. He got lots of metal. This type of injury is very severe, but he did great.
How do they do afterwards recovery? Is it like a human, or do they have to have therapy, or is he just, what happens?
Physical therapy is great for our veterinary patients, but they're tougher than we are, and oftentimes can recover without it. But it normally takes about 3 or 4 months for them to really get back up to speed.
All right, let's look at the next picture.
This is a little guy that got out in the road, and so he should have been on a leash, but he wasn't, and he
got hit by a car?
Got hit by a car, and so he's got a broken pelvis. It's broken in several places.
Oh gosh, poor thing.
We ended up, he got bilateral pelvic plates, and he was able to get back up and return to normal activity.
That is amazing what you're able to do.
Years ago, those kind of cases would not have had surgery, they've had cage arrest. We've come a long way in veterinary surgery with guys like this doing it.
A lot of times you couldn't save them, right? Then you would.
Well, medicine has advanced so far, and we have a lot higher success rate with being able to treat traumas.
I think we have one more picture, don't we? I think so.
So this is a puppy that was a small puppy that got bit in the face, and it's got a broken jaw, and that's hard to see with the x-ray.
At the very bottom of the film there, the great white area, that's the break, I believe, of the jawbone.
Okay.
Yes.
So he just encountered another dog.
Just another dog. He was sniffing around, and the other dog didn't like it, and so he got bit on the jaw, so he broken jaw. We put a plate on there, and he went on to heal well.
So as we wrap up, I guess the lesson to all this is it's available if something happens, but maybe there are ways. Some accidents are going to happen, but you said sometimes you can try to avoid them.
Yeah, if we can keep our animals on a leash, that's probably the best way we can avoid injuries. When they're traveling, back of the truck's not the best place for them, so if they can ride in the cab, and then just trying to be good parents and keep them from getting in trouble, really.
And Dr. Vaughn indicated to me earlier that they have a CAT scan now that they're using, and for veterinarians that in general practice like myself, that's another tool that's available to us as we refer cases to the veterinary surgeons. That's a wonderful opportunity for us to advance our medicine to another level.
Well, you certainly don't want to have to get to that, but we're glad to know that it is available. Thank you both. Thank you both. Fascinating today. All right, now here's Jay.